Hey Iowa, it is Congressman Nunn. I'm coming to you from downtown Des Moines to talk about the Help for Mom Act. And these great leaders behind us are some of the front line in making sure that we are taking care not just of mothers and babies, but of our entire community across Iowa. And there's still so much more work to be done. So I'm thrilled to have the opportunity today to talk about opportunities for success when we face a very serious challenge impacting families across America, and certainly right here in Iowa. Challengingly, the U.S. has the worst maternal mortality rate of all the advanced countries, in part because many women live in areas where they don't have access to the care that they need. Unfortunately, today, nearly 2 million women live in areas without the right access to maternal health care. In fact, they're maternity health care deserts. To bring this a little bit closer to home, I have the privilege of serving in the 3rd District, and it's a giant compendium of 21 amazing counties, both in urban areas like right here in the capital city to our very rural areas, all the way down to the Missouri border. Over half of those are at a point where some or all of them don't have access to the maternal health care that women, mothers, and babies need. So this team has taken a first step in making sure that we can make a difference, and I'm committed to making sure that we can have a bipartisan solution to help folks right here in Iowa and across the country with action we can take in Congress. It's clear we need to ensure not only better access for health care for pregnant women before, during, and after pregnancy, but there are opportunities we can take today to make that better. If there is access, in today's world, it's extremely expensive, particularly for those without insurance. On average, pregnancy, delivery, postpartum costs can run over $3,000 for patients, and those are the ones with insurance. And according to the Center for Disease Control, nearly 80% of maternal deaths could be prevented if proper care were available. So let's talk about solutions that can help not only drive down those deaths, but also help mothers and babies as they begin this process. That's where Health for Moms Act comes in. It's a way to improve access for maternal care, particularly for low-income families in rural or underserved urban areas. This common sense bill would provide grants to states to improve access where comprehensive maternal health care for low-income women could be expanded. We need to do something not only to address the maternal mortality crisis, but to work together to make sure that we have got better access across the board. As we discuss this critical issue, I am just honored to be able to work with practitioners who are leading in this field. The Iowa Primary Care Association and the primary health care team here are working to address the needs of pregnant women across our state. And so to begin with, I'd like to ask Aaron Todd, our CEO, to join us up here for his work on what Iowa Primary Care is doing in this area today. With that, Aaron, thank you. I appreciate it.
Well, thank you so much, Representative Nunn. We really appreciate you being here today and even more importantly, working on this issue. It is incredibly important to all of the community health centers all across Iowa. And as Representative Nunn mentioned, I'm Aaron Todd. I'm the CEO of the Iowa Primary Care Association. We represent and support Iowa's 14 community health centers all across the state of Iowa who care for nearly 250,000 Iowans on an annual basis. Community health centers are vital to their local communities, providing an integrated health home where patients access medical, dental, behavioral health, and pharmacy services, often under one roof. As primary care providers, we continue to see the challenges associated with maternal health across the state and nationally due to workforce shortages, lack of access in both rural and urban areas, and patients not receiving prenatal care. These challenges lead to poor health outcomes, sometimes even resulting in death of the child or mother and increasing costs to the healthcare system, most of which are entirely avoidable. As is true with most primary care services, investing upfront in smart services, in this case in both prenatal and postpartum care that is accessible and coordinated and linked by thoughtful patient engagement strategies, is a proven model for both building a strong foundation for optimal health for both moms and babies, and for reducing costs in the healthcare system for all of us. On behalf of our members and the over 1,400 community health centers nationwide, I want to thank Congressman Nunn for introducing this legislation and for working with us to understand what those challenges are and what some of those policy solutions might be. We appreciate his leadership to address maternal health access issues, further supporting the primary care model and supporting the health of all Iowans. So thank you so much. I'll turn it over to Kelly Huntsman.
Thank you, Aaron. Hey, I appreciate it. And Kelly is one of the practitioners in the field. This team has been phenomenal, both on this side of the podium and the other. As a dad of 6 kiddos, 2 who have been in the foster system, access to it is across Iowa. This isn't just related to only urban areas or only rural areas. This is something we've got to get our arms around. Kelly has been helping lead some of the pilot programs to help serve that. So with that, Kelly, yeah, if you wouldn't mind sharing with us what you've done with CHC.
Absolutely. I'm Kelly Huntsman. I'm the CEO of Primary Health Care. I have the honor and privilege of working with a wonderful team. We've been providing maternal health care in this community and in surrounding communities for a number of years, probably around 20 or so. And I'm super proud of the great team that we have and the work that they do and the commitment they have to our patient population. Just to give you a little bit of a background, we have around 1,200 pregnant women in our care at this point in time. Last year we did around 600 deliveries. The majority of those deliveries are to low-income vulnerable populations. About half of our patients, at least in this community, are uninsured, which means we are primarily, there are other providers, but access for them is a real challenge if they lack insurance, and so we really serve that need. We were fortunate enough to get a federal grant from HRSA, which is a maternal health home grant, and we're super excited about that. We would consider ourselves a maternal health home prior to that, but this grant really has allowed us to be innovative and try some new things to really expand care out into the community and to provide better service. So some of the things that we've tried in that with that grant, we've hired community health workers who are doing lactation services in addition to the community health work that they do, which is really expanding access for our patients who may not have had access to those kinds of services. We're trying remote monitoring so that pregnant women who maybe have issues with transportation can do some self-monitoring at home, make sure that they're healthy, and if not, able to connect with us to address those issues in between appointments. We've trialed some telehealth. Telehealth is not a new thing for us, but in the context of OB, it isn't widely done, just because usually you want to have hands-on, or the clinicians want hands-on care, which we do, but when we can't have that, telehealth has definitely been an option. So lots of very unique things that we're trying to really improve care for our patients. Really are super appreciative of Representative Nunn's bill. We do have significant gaps across the state and in our own community. We feel it every day. When we look at our patient population, they are vulnerable in many ways. They have barriers to care, but additionally they are high-risk women. They are women who have many conditions that make them high risk for delivering a healthy baby and being healthy themselves after delivery. And so this community right now is facing a challenge around access. Many of our hospital partners are at capacity in terms of prenatal care. And so we are struggling to find a solution right now to care for those vulnerable patients who need access to quality health care. So I commend Representative Nunn for his work and his legislation, and we really need all the help we can get to try to find healthy solutions for our patients. So thank you.
And Kelly, Aaron, the entire team, these are recommendations that come from Iowans. These are things that are going to help Iowans. This legislation is a reflection of the hard work that you guys have already laid in. So thank you for giving us the firepower, as it were, to take this to Washington, help Iowa, help the country. We're driving good decisions. I appreciate it, guys.
Thank you.
With that, thanks Iowa, and We'll keep fighting for you.